in listen-only mode.
Hi everybody, thanks for joining us today. We'll be starting in just a moment.
Yeah. Otherwise, maybe you're working at all.
Julie.
So, good morning, everyone. This is Cristina Martinez, County Liaison for the Colorado Department of Human Services. Thank you so much for joining us today for our interagency presentation on the Affordable Care Act in Colorado, an update on implementation for counties. We have several folks in the room with us today. If everybody could please go around, state your name and your agency, and then we will get started with the presentation.
Hi, this is Emily Mongrovius. I'm a County Liaison with CDHS.
Antoinette Taranto with Healthcare Policy and Financing.
Tammy Costello with Healthcare Policy and Financing.
Mike Wagner, Healthcare Policy and Financing. Chris Munn, Office of Information Technology.
And Julie Kirksick, CDHS, Office of Economic Security. So welcome. This is Julie, and I'll be moderating, such as it is. We are really pleased that we have the opportunity to share this information with you. The order will be that Antoinette and Tammy will co-present on, if you will, the content of Affordable Care Act, changes and implementation. And then Chris Munt, who is the manager of CBMS, the director, sorry, of CBMS operations, will walk us through some of the technical changes and processes that we'll be going through in the changeover for October 1st. And then I will finish up with just a few comments on contingency planning related to things that, if they're not covered elsewhere, and some special contingencies that we're looking at for CDHS programs. At that time, of course, we will open it up for discussion. But usually we do have people, you can be submitting questions as we go. If they're clarification questions and simple, I will leave it to our team over here, Cristina or Emily, to interrupt us. But otherwise, we will leave time at the end for questions that arise or discussion. The last thing I would like to say is that some of this information was shared with you last Thursday by a panel that included Antoinette, Tammy, and Chris at the CHSDA event. So for those of you who are on the phone, I don't want to discourage you from staying on the phone, but I just want you to be aware that there may be a little more detail, but it's largely going to cover similar ground. So with that, let me turn it over to Antoinette.
Good afternoon, everybody. I want to let you know that I think a lot of us at HICPUF have a little bit of a zombie zone going on because we're working so hard and we're doing everything we can to make sure we're ready for next week. So I appreciate your patience as I stumble through this. So we are, as Julie mentioned, we have gone through a lot of this already, so this is probably duplicative to some of you. It may be new to others. We're going to try to go through it as quickly as possible, and if folks need us to slow down or have questions, I don't know how that works. You guys all know how to communicate with us to let us know to slow down or you have questions?
So there's two different options. You should see a chat and or question box, and please feel free to use either. We'll be monitoring both throughout the entire presentation.
Great, thank you. So on the overview, we're going to talk a little bit about training. We have training going on in Denver now. This is the week right before Go Live. And then we're going to talk about the single streamlined application, Peak, our call center, what we're going to do to support you for Go Live, a little bit about communications, and then an update on funding. We've been in touch with a number of you that have, oh, sorry, I'm jumping around. Like I said, we're working too hard over here, a little bit disorganized. So on the in-person, the training update, this slide shows you everything we've done so far. We have folks in Denver doing training for regionals. We have a website link for anyone that wants refresher information. That's colorado.gov/HCPF. And then you'll click on training events in the quick links box on the home page. So it's right on the home page to get those refresher notes and information. The training materials will continue to be updated and will evolve. This is a very large rollout. We're doing a year's worth of work all in one release. So we will be changing things as we go. And then we are also planning on continuing webinars through October. So every Tuesday from 1 to 3, we are going to continue to have webinars. So that's it on training, and I'm going to turn this over to Tammy to talk a little bit about this single streamlined application.
Great. So as some of you know, or maybe all of you, I'm not sure, we were required to do a single streamline application based off of the new regulations, rules and regulations. That single streamline application will be effective October 1st of 2013. It is now available on our website. In addition to that, we've had to do a supplemental page that's also now available on our website. So what we're asking with that supplemental page is if you're not able to get everything processed, before the system goes down this week, then we're asking that you use that supplemental page and get it distributed to your clients because that is new information that we're going to need to determine eligibility. Or if you're using the old application still because you have an influx of those still applications, we're also asking that you use the supplemental for those clients using the old application. Once you're all out of the old applications and up to date, then this new streamlined medical-only application will take place over the old application. In addition to that, we've been working with our DHS partners and some of our county partners to create the public assistance application, also known as the SPA. That is also out there on the website and available for use. And the SPA is if someone's applying for medical and food assistance or call out or works outside of medical. I think, sorry, I'm on the slide 5.
Okay.
Yeah. So Go Live, we will have the medical-only application for those clients that are only wanting to apply for medical. Again, you're able to print those out via our website. We also have the SPA that's also available on our website. And we have the supplemental, in which I was referencing, on our website. In addition to that,
And Tammy, could you
yes.
just clarify SPA
Oh, I'm
versus
sorry.
the other?
Okay. Yeah, the SPA is the single purpose application. That is the combo application for medical programs in addition to any DHS programs such as food assistance, Colorado Works, adult financial, etc. So thank you for that.
We do have a question about how to order the form for the new applications since there's no form number.
So we are going to be sending out to all of the sites new applications.
Including the supplemental
Including
pages.
the supplemental pages. So we will be sending them out to sites. I believe that new applications we're targeting them for delivery for October 1 so that we don't have people submitting them prior to and things being held. And we have looked to make sure that the printer has time to print them and send them. So we're planning for October 1, those to be released. They are on the website if you do want to print them yourself and download them.
And as far as ordering them, then I don't honestly know the process of that, but we can find out. And how do you order them for future use?
Well, we want to go through a stakeholder process since we haven't had a chance to do stakeholder feedback yet. We are going to do a stakeholder process, and then after we get all the feedback and make our changes, then we'll start making it available to actually order. But we really want to have some control over what's out there because we're pretty certain it's going to change fairly frequently since we didn't get an opportunity to do that stakeholder feedback.
In addition to the new application and the single-purpose application, there's a quick reference guide that's also available, and we're suggesting that you print that out. That's also on our website to help guide you through these new applications.
So there's a question, if a client submits a SPA prior to 10/1, do we send the supplemental form to the client and pend 10+1 days? If not returned, are they denied?
So we have no logic in the system that would allow you to pend for that supplemental form prior to 10/1. So that's why we're pushing really hard to get all the applications in and that were received and entered into the system prior to October 1. However, understanding circumstances, if you're not able to do that, then you would just enter the information into the system, and we would be running off of the new eligibility rules come 10/1. If you don't have the supplemental, then the tax information would be considered a non-filer at that point. So that's what would happen as far as system goes. If for whatever reason you're knowing, there's just no way I'm going to get to these set of applications prior to 10/1, our suggestion is to send those supplemental forms to the client. However, there's no system automated, I'm going to pend and then deny for the supplemental form.
Is there a cost to ordering the forms?
As of right now, no. Again, we need to do the stakeholder feedback, and at some point there may be a cost, but we're limiting the availability of them, knowing that we're going to have short supply to get that stakeholder feedback.
Could I just make sure that whoever asked the question about pending is comfortable that you understand the answer?
There are lots of questions coming.
While we're waiting for that, there's two questions that deal with verbal information. One is if a client provides a phone number, can we call them and take supplemental information over the phone? And can we accept verbally the info that the supplemental requires?
Yes.
Okay.
Yes.
I like that short,
Yes.
sweet answer.
And then another question, where is the supplemental form for printing? We have on our webpage, colorado.gov/HCPF, There should be a link to eligibility or application. I found it really easily. I don't know exactly the rest of it, but it's right there on the left-hand side. It says eligibility or application, and then it gives you all of the forms,
So if I
including
may,
the supplemental page.
this is Julie again. If I may, I'll take CDHS, put us on the spot and say we'll find that link exactly and send it out after.
Yeah, it's right on the home page on the left-hand side. I think it says application or eligibility.
Thank you.
And now let's let Tammy continue.
Great. And just I want to clarify on the supplemental page because I know there are probably a lot of question marks around that. So really the guidance is when you should be using the supplemental pages for any application that was completed prior to October 1. For any single purpose application that was completed to prior one as well, or if your client is reporting a change based off of their income or any other changes, you should gather that information. You are able to complete that form via phone, and then you can just put some case comments within CBMS. So we have that for an audit purpose trail.
Again, we may want to come back to this at the end, but I want to make sure we get through.
Absolutely. So then the next thing that we want to talk about is our new peak landing page, and kind of give you, we kind of showed you within the diagram the past peak, the present peak, and what the future peak will look like, at least on day one. Peak will be as dynamic as we were able to make it for day one, understanding that there's always room for improvement, and we will continue to improve peak. We will be able to do a real-time determination via peak for medical programs. And when I refer to medical programs, those are medical programs in which we're able to take self-attestation and use data sources for. The new peak will contain the new single streamline application questions outlined for the medical purpose only application. It's client-centric, meaning it's less text on the screen. We really tried to incorporate a lot of the UX 2014 elements. UX 2014 was a combined effort with multiple states, federal agencies, tons of consumer feedback. In addition to that, you're able to add a person and report your changes. And those, again, are some of the changes that we're doing to peak. And what you'll see on day one or after as we progress.
So it looks like we have some specific questions on application.
Okay.
So it says the Spanish application is not yet available. What form should be used instead?
It's our understanding that the Spanish application will be available prior to 10/1 or on 10/1. It's currently being translated and should be available. That's what was confirmed to Antoinette and I last week, I want to say, is what we were told.
Is there
Right. If for whatever reason it's not out there, we'll make sure that we get guidance out via the multitude of venues that we have and let you know what should be done in place.
Do the applications have to be authorized by 927 or just inputted into the AI so the supplemental form is not needed?
They need to be entered in 927. Are we running your BC? And authorized by 927, both. So it needs to be entered and authorized. Because if it's not, then the new logic will pick up
And you need the supplemental.
and you'll need the supplemental form.
Okay, we were previously told that we would need to submit a special problem log ticket for those pending applications prior to 9/30/13. Has that process changed since we are now going to use the supplemental form?
I'm not sure I understand the question. So It's not my so there is some confusion out there in regards to when they should call the help desk. You should call the help desk like you do today if you're having any system issues or if you believe your determination is being incorrectly determined. There is a new process that's in place for any ongoing applications that need to run back prior to October 1 because they need to switch to a new aid code, etc. But those are ongoing applications that you now need to run back on. So it's not any new applications. It's anybody that's receiving benefits today and after October 1 that for whatever reason you need to run back. With that, you're not able to do that, and that's when you would follow and open a help desk ticket, and then there's a process in place to do that. So I hope that helps clarify, and I hope that answered your question. If not, please let us know.
So just to clarify, if we are unable to complete the applications that we received before 10/1/13, we are to still process the case without the supplemental page as a non-filer if we cannot get a hold of the client?
That's what the system will do. Our first recommendation is to reach out to the client and try to get that information. But CBMS won't pend for that information. It will read the blank fields as a non-filer, which is not ideal. But yes, that's what will happen from CBMS.
And we had one other question pop up. We need guidance on how to process redeterminations for October. The R3 form has not been changed to our knowledge. I know we have the auto enrollment, however, we need information if we have to have worker intervention.
So auto enrollment and ex parte will continue to happen come October 1. We understand that we were not able to get that information into the RR for these redeterminations coming in. So again, you could reach out and gather that information from your client, or you can enter what is received, and we will treat that client as a non-filer and get that new information at the next update or RR.
So this is Julie.
Right. So just for medical programs, that is not an ideal situation, we understand, but due to the other priorities and everything on our slate, that is something that we're working towards getting into the new redetermination packet.
So this is Julie, and I now want to suggest a change in process. I know I said we would take questions as we went along, but because I think we have a mixed audience, I would like to suggest that we allow Antoinette, Tammy, and Chris to make it through their presentation. So if there are people who don't need to know or may not even be able to follow the technical questions, that you will at least have gotten the overview, and then we will take all the time we need to answer more technical. So I hope you will bear with me for that change in direction, because I don't want to cut off these questions. I just want to see if we can maybe get through the presentation so those who don't need the more detailed information can at least have a full picture.
Great.
So Tammy.
So now Antoinette will be talking to you guys about the call center.
So we are getting ready to bring up the call center. The call center is going to give us the ability to record that electronic signature. And if any applicant calls you asking to apply over the phone, direct them to customer service. The phone number is up there. You select option 3. And before you do that, make sure that you give them an option or notify them of what their options are to apply, which can be in person, it can be filling out the paper, or it could be peak, whatever's most convenient for them. So now I'm on slide 8, the command center. This command center is something that Chris is probably going to talk about in much greater detail, but all of the systems that we currently have in place today are what we're going to continue to use. So continue to submit your help desk tickets. We are also going to have on-site support at some of the larger locations. We're going to be handling all small and medium-sized sites through sort of like a account rep or white glove type process where you will have a dedicated HCPF staff reaching out to you every day to see how things are going. They will all these folks will be reporting back into the command center, and we'll be doing summary calls every day so that everyone knows what's going on. So you know it's not just me, it's everybody's experiencing the same things, and what solutions we have in place or that will roll out. That command center is going to include HCPF, OIT, Deloitte, all the DRC, Peak Outreach, DHS, Connect for Health. I'm reading the long list that's up there on your slide. All those folks will be there. So we should be able to very quickly turn around workaround solutions very quickly for you. So that starts Monday, September 30th next week, and Tuesday. And there's the information on the calls, 12 to 1, and then 4 to 5. And then additional calls and days will be available if needed. And then we'll get the actual call-in information at a later date. So then on slide 9, this goes back to the call center support. Again, sample script. Folks had asked for a script. This is a sample. Please, modify it to suit your needs. And then we jump back on slide 10 to what we're doing for on-site support, which we just talked about. Slide 11. Again, we're using our regular forums for getting information, problems into us. Policy clarification, continue to use that Medicaid eligibility inbox. The system issues, submitting a help desk ticket. Okay, so continue to use what you know because we will have those staffed and feeding into the command center as well. Slide 12, communication. Any media inquiries, requests, and responses, we're requesting that you coordinate with our Public Information Office. Rachel Ryder's information is there. And then slide 13, we are working on some toolkits right now to help you so you know what some of the notices are going to look like, to help you with the applications, what to use and when. Slide 14, we talk about our consumer resources. That's also part of the toolkit, and we have the link there at the bottom of the slide. These are things to help your consumers. And then on slide 15, we've got some messaging and some other resources, what the difference is between Medicaid and Connect for Health Colorado. All of this is on our website. Slide 16, and I know I'm speeding through this. Again, it's more resource information, communication on Peak. And then on slide 17, we have a new consumer site. It's colorado.gov/health. This is an interagency site partnering with the Division of Insurance, HCPF, Department of Human Services, and the Department of Public Health and Environment in collaboration with Connect for Health Colorado. And the purpose is to help consumers and get them information quickly about healthcare reform and quickly direct people to the resources they need to get help. Slide 18 is a funding update. We submitted a supplemental request and it would allow about $2.5 million to support the HICPUF overflow and application processing and some of the back office support of things that we anticipate we may need, but we aren't sure. And then $7.5 million for the counties. Again, keep in mind, this is after CMS approves the enhanced match. Not every dollar is eligible for enhanced funding. For example, appeals work, fraud work is also at that 50-50. It's not at the 75-25 match. Please stay tuned, though, for more information. Our director, Sue Birch, will be sending out more information this week. And as soon as we get information, we want to get it out to you because we know this is a really critical piece for us to be able to implement successfully. And then on the last slide, just staying informed, we have our director emails that go out every week. And then we have our ACA implementation news. We also continue to use our CBMS communications and our director and agency letters. So again, we're not reinventing the wheel on communication. We're using the forms that we always have used. So keep your eye out for them. And as always, ask when you have questions.
Will the new consumer site connect to PEAK?
That's a great question. I'm not sure.
There's a link that I
Did you see a link?
Filling around, yep.
All right, so
Great.
let me just
There's a link. Yes.
suggest we will get that link out to people. But thank you so much, Antoinette and Tammy. And now I'd like to turn it over to Chris Munt, please.
Hey folks, I think I spoke with a lot of you last week, and because I forgot this was a webinar, I did wear a tie. I'm looking very sharp, and you should all know that.
You are looking sharp.
Thank you. I do have some things that I will go over that may be a little bit repeat, but I think are worth mentioning. Just how large this is, and I think I shared with you, this is roughly twice the size of our June release, and our June release was obnoxiously large in my opinion. From my experience, my 13 years of IT experience, this is just, it's unheard of. It's obscene, the number of hours that are being put into this release, the amount of testing, and the amount of diligence that we're doing. So the first, and I apologize, the materials that I submitted are all PDFs, so they're not very presentation friendly, and I don't expect to go through them all, and you'll see why in a moment. But the first 2-3 pages are something that I'm pretty proud of. It's a lot of fun facts about CBMS, things that you should be proud of, how many clients we serve, how much work we've done to serve our Coloradans. So some of those fun facts are 11 million lines of code, 20 different technologies that we've implemented, 29 systems that we integrate with. And in the second and third page, I put some red text there, which is specific to our September release. 25 man-years approximately are being spent coding this puppy, so tons and tons of sweat put into this product. And on the third page, some information about testing. Since I've been here, one of the things that I think folks mention with good intentions but ruffles my feathers a little bit is, have you heard of testing? You may give that a try. We do testing, believe it or not. I know that we've had some bumps along the road, but that is, to me, the way of software. We've tested over 6,600 scenarios, and I would guess that we're probably over 7,000 now, and we've found nearly 1,000 defects and fixed 1,000 defects. So while we may see some wrinkles, and I fully expect that we will after go live, understand that we've had about 30 dedicated staff for the last 3 to 4 months testing this product to make sure that it is good as we can possibly have going out the door. The rest of the PDF, the other 27 pages, which I'll save you from reading, is really to illustrate what's available to your staff, your CBMS workers. All of this is available via the CBMS portal, and something that is a little regrettable is back in the fall, we revamped the portal, and we really made it current. We made it a lot easier to navigate. We kept it current, and we had a lot of good information. And we did that so that you could pull it, so that we're not pushing a whole bunch of information to you through emails, and so that you could always get the latest and greatest, and you weren't debating over whose email was correct. The other 27 pages, it's all on the portal. And it is such things as, if there's a part of the PDF has a nice blue tone to it, very attractive. That talks about what that weekend is going to look like, what next weekend is going to look like, what will be available, what won't, how we're going to communicate to you.
Can we just stop there, because I think that is worth going over.
Sure thing. So that one is titled the September 2013 Release Roadmap. And it is a fairly detailed and nerdy look at how we're going to execute come next weekend. The system will go down on Friday the 27th at 6 o'clock, and then you can see, I think it's on the second page of that presentation, a pretty detailed timeline of all the nerdery that we're going to go through to get you up by 6 o'clock in the morning on Monday. Lots and lots of work. We'll have a few hours of slush time in case we have some difficulties, but by and large, we will use all 3 or 2.5 of those days to get you ready. The rest of that deck goes through some of the things that you can and can't do. So that third page talks about what is going to be available on 9/30 and what is going to be available on 10/1 and what you may need to do to get around the availability. So for instance, the big one is being able to run EDBC on Monday. Being that we are not officially live until 10/1, that's the way we're going to have to roll with that. So it's good information for your workers as to how to handle that and what some of their alternatives are. And then as you get further into the deck, we talk about our support, our command center again, which Antoinette mentioned before. We really have tried to overextend help in the sense that you can get a person that has actually been part of the development team, been part of the testing team, by picking up the phone. And you can get that comfort to say, is this just me, or is it other people in my building, or is it other people in the state that are having this issue? And if they are, what are they doing about it? Highly encourage you, if you're having problems, to call into that line. Otherwise, if you're not having problems, by all means, you can call into a couple of the summary calls, one at noon, one at 4 o'clock, to kind of get the wrap-up of what's going on and some defects that we found. Other pages in this awesome and large PDF. Beyond that blue slide deck, there's 15 pages of release notes. As I said, September is massive. Release notes are something we do for every major release. We even do it for minor releases. This is nothing different. It is on the portal, but I think release notes are an awesome way of getting your workers quickly up to speed as to exactly what we're doing and why it affects them, the intent, and what they can see in CBMS that'll be different. Beyond those 15 pages, bear with me. CBMS changes fact sheet. We tried to condense a lot of this material just because it's so hard to digest. That sheet talks a good bit about case assignment and the security changes. So that way your workers will know, given the type of application, where the work is expected to go, and some changes as to the access and what they'll be able to see on 10/1. The next presentation, or the next document, is called the September 2013 Build Activities and System Availability. This is similar to what I showed you with the times and the dates for the weekend of our Go Live. It's a little bit more condensed and a little bit more focused on what your worker needs to know. When the system's up, when the system is down, what kind of functionality are they going to have versus not, and it's really on a one-pager. So that'll be nice for them to have, maybe have it at their desk so that they can understand, oh, I can't run a DBC. Why? Well, because we know we can't on the 30th. The very last page, I showed this at our last chat last week. Awesome flow diagram that you probably will not want to read, but it does detail out how information will flow on Monday and Tuesday. There really is multiple avenues that you can get help. First of all, starting with a help desk ticket, as Antoinette and Tammy mentioned. We want to start there just so that we can track it and we can group tickets together and understand if we have a multi-user problem. But then, by all means, call into that command center, and you'll find some friends, and we'll get through it together.
Thank you, Chris. This is Julie again. I'd like to just mention a couple of things, and then we're going to open it back up for questions. One of the things, neither Chris nor I were anywhere in this state in 2004. I'm not sure how true that is for Tammy and Antoinette. Were you part of it?
I was here.
Yeah.
I was at a site.
Okay, so I think that one of the things that Chris and I have both mentioned on multiple times is that even if one wasn't here in 2004 when CBMS went live, we can see and feel today still the effects of that, and we are doing our best to avert those kinds of chaotic and ultimately incredibly destructive weeks and months that followed the release. So this webinar is trying to make sure that we get the information to you, and I want to ask all the directors who are on the call to please make sure that you really do go through all of this information, even if it isn't specifically, even if you won't have to actually manage the workers through this, but to make sure that you know what is out there. And then obviously further down, the supervisors, managers, and so on who are working with our workers directly, please make sure that your workers have this. So that is to say that we don't anticipate that we will have the kind of disasters that we had in 2004. On the other hand, we are careful to say that we understand and know that there's anxiety about what ifs, and we are trying to address the what ifs. So partly I want to just say, particularly from the CDHS side, although the focus clearly is on the changes to our medical programs, we also know that there are knock-on effects that will occur or likely occur if people are applying for more than one benefit. And eventually we want to actually make it a lot easier for people to be able to apply through all these different portals for multiple benefits. If the the command center is the main way that we are going to manage contingencies through in-person, on-phone, online contact. But we also have created a joint document that is just being finalized today, and it will go out in all these different formats. We'll send it out. Christina can send it to everyone who participated today. It will be on the CBMS portal, and we will put it on our home pages, our department program areas as well. So again, I'm not going to go through all of the detail now, but the big things I'd like to say are that we look at what the difference between a system limitation, that is slowness, or the system being completely down. And so there will be different steps that will be available for both of those. Again, in this document, you will see more repetition about the command center, media inquiries, and on-site support inbox. Again, please forgive us, but we feel like we know you've been waiting a long time for these details. Now we finally have them. We want to just shoot them out as many ways as we can. Then what if the system does go down? If the system does go down, overall, the short, simple answer is if it goes down for a day, we would not expect to go only to manual. But if it goes down more than a day, we are expecting that we would support you with manual applications from the program areas of both departments. We are preparing both manual applications, but also we will have electronic but non-CBMS spreadsheets that will calculate eligibility for you, for the worker, if that happens. And that is and we will then also have a way for our vendor, our EBT vendor, JP Morgan Chase, to be able to pay out benefits other than through CBMS, which is currently the only appropriate way to do that. So that's what I wanted to say about contingency, and I wanted to, what do I mean by a manual application? I mean literally a piece of paper or papers that the worker will be filling out, whether over the phone or in person. I think Antoinette wanted to say something else, and then we'll open it up.
So there is a lot of comparison happening between what we're doing today and in 2004 with CBMS bringing it up. And I do want to just clarify there is a distinct difference. In 2004, there were known defects in testing, and the decision was to go live anyway without those defects being fixed. Today, we've been testing since April, May. We've been testing for a very long time, and everything's being fixed. So I just want, I don't want folks to freak out because we have really done a lot of testing, and are there going to be things that happen? Absolutely, but we're not flipping a switch with big problems that we know are going to happen on day one. It's not quite comparable in my mind. So I just want you guys to understand that and know my perspective on it.
And there are nodding heads all around the room here. We agree. Now let's open it up, please, for either comments as well as questions.
So we have a question. What would manual payments look like? How would they get paid, etc.?
That's what I was referring to in saying that we will be sending out these documents to you, the electronic spreadsheets, and I'm still awaiting the answer from our EBT, the electronic benefit transfer people here at our department who are getting the answer from JP Morgan Chase. We know it can be done because we did it on a limited basis after the tornado hit in one of our northern counties in 2008. So we know that we can get payments out even if we don't have CBMS. Will it be pretty? No. We are, way hoping that we won't have to go there. But if we have to go there, we will have a process for you.
Will county directors receive a toolkit that relates to the contingency plan that's in place?
A toolkit. I think we can, I think the first thing I want to suggest is that we will send out the PowerPoint as soon as it's finally approved, which I've asked for by close of business today. And I think once you see that, if that is not sufficient, then let me know, please.
And we had one technical question that was asked earlier. We're authorizing FMR3s that are due in September, and their med span is showing as only going through 9/30, even though they are approved ongoing. We have case examples.
So let me translate. We are authorizing family med reauthorizations, is that right? That are due in September. This is all part of getting ahead. And their med span is showing us only going through the end of this month, even though they should be ongoing. So I'm not, is that directed toward HICPUF or OIT or both?
This was asked when Tammy and Antoinette were presenting.
So family med authorizations, I'm assuming that's redeterminations or new applications. Regardless, that makes sense to me because the system is for medical programs technically at an end in September and then a new beginning in October, which is no freaking out, no like, oh, does that mean we have to rerun these cases? No, it doesn't. It's just those will be set for conversion for October 1 forward. So that's that definitely makes sense to me, as they would only see the med scans going through the end of September. To make, if there's still like some concern around that, we do have some reports in place to identify all of our cases that will be converted over, and we will be doing checks through quality assurance just to make sure that that conversion happened appropriately.
Do we have any other questions?
Or comments?
What specifically will the counties need to do to prepare for manual payments, if anything?
That's what I was trying to explain. We don't know the answer yet to that because we are still working it out with JP Morgan Chase. And again, I think the odds of this happening are low, but we were asked to prepare for the worst case, and this is the worst case, but it is taking a while for JP Morgan Chase to figure out how we can do this. I'm just assuring you that we know it can be done, and we will have an answer in the next few days.
You mentioned that manual payments were done previously. How were those handled?
I was not here then, so I can't answer that question. I'm sorry. Is there something more that I can do to assure you that we will figure this out? I know we're down to just days and hours, but I just can't provide any more detail than that. I'm sorry.
And we can perhaps have somebody from your shop provide follow-up with this county?
Yes, absolutely.
Okay.
I will have someone who was here in 2008, either Sue McGinn or Scott Barnett, who is our EBT manager, or Trish Hesse. One of those three people will follow up with you specifically. Is that Lisa? Lisa.
Yeah. If a non-system determined issuance is done, will CBMS recognize it and not pay it again?
Let me try and process that one. If a non-system determined issuance is done, will CBMS recognize it and not pay it again? Yes, that was handled, yes.
When we go down Monday, will the system batch on Tuesday morning or will it be Tuesday evening?
It's a regular batch cycle, right?
Yeah, I believe it would be, this is Chris, I'm not positive on that one. I would guess it would be in the evening, but that's one of those things where I think the folks in the command center are going to make that call as we need it. If we've had a day, an entire day out, I think that we do have some flexibility with Deloitte to change things up as we need to. But my presumption would be that we would follow our normal schedule, which I believe is in the evening.
Evening.
Are there other questions?
Comments, concerns, other than this big question about how will we actually make manual work, which I will assure that we are going to get out to you.
Well, I don't think we've received any more questions, but please know that if something comes up later on, we're all available to help you get the answers that you need so that we can all be successful come October 1. Again, thank you so much for joining us. Emily and I will be sending out slide decks as well as a link to YouTube video once we're able to encode that and get that uploaded. And again, we thank you for your participation. Have a great afternoon, everyone.
Thanks, everybody.